Why does Medicare have to be so confusing? Hi, I'm Anthony Selm with Medicare Easy Street, and I'm a licensed independent insurance agent based in Cincinnati, Ohio. Our agency specializes in Medicare, so I wanted to make this short video to help you understand how Medicare works in simple terms. It can be extremely stressful coming up on that 65th birthday with a huge healthcare decision to make. So sit back, turn up the volume, and I'm going to hop behind the computer. Over the next 15 minutes, I'm going to arm you with the right questions to ask when the pushy salespeople come a-knocking.
All right, so here we are, turning 65. What are the Medicare choices? Before I dig into the training, just wanted to introduce myself. I'm born and raised in Cincinnati, Ohio. I've been a licensed agent since 2006. I've been an independent broker since 2013, and our team has helped thousands of individuals enroll in health plans. A few benefits that we offer: an unbiased look at over 20 different insurance companies, an advisor on the ground. We're in the field working with folks talking about Medicare every day, so our job is to stay on top of new rules, regulations, changes that might affect you. We review your coverage every year to make sure that you're not stuck with a plan that might not cover something that you need for next year, and there's no cost for our help. We represent all the major brand name carriers and many others. Today we'll cover Original Medicare, what does Medicare cover, your choices, Medicare Supplement or Medicare Advantage, what is a Medicare Supplement plan and how to compare, what is a Medicare Advantage plan and how to compare, Part D prescription drug plans, and all the important enrollment dates. So let's dive in. And first, before I go any further, I did just want to reference all of the information I'm going to be giving you today is right out of the Medicare and You handbook. If you don't have a copy, you can go online and view a copy of it electronically or order one from Medicare's website. This is the official U.S. government handbook and has all the necessary information you need to know about Medicare in it. It's just a rather dense reading material, so I've simplified things to help you make more sense out of it today. And this page is right out of the Medicare and You handbook. So let's start with the basic parts of Medicare. What are the parts of Medicare? Well, you have Part A and Part B are the original Medicare hospital and medical insurance. Later were added Medicare's Part C and D. You can see Part C is not listed on this page because it is also known as Medicare Advantage, and we will discuss that separately. So let's get started at the top and talk about what is Medicare Part A hospital insurance. First off, some things to know about Medicare Part A. Most people are eligible for it at age 65. There's no cost for Part A as long as you have worked for 10 years or 40 quarters and paid taxes into the system. Medicare Part A works with any hospital that accepts Medicare nationwide. Your benefits will restart after you are out of the hospital for 60 consecutive days. So it works on a per hospitalization basis, not a per year or per benefit period basis. You also have what's called lifetime reserve days. Once you've used those days, they will never be available again. I'll talk about that here on the next page. So, someone that has original Medicare Part A coverage and they're hospitalized, what are the out-of-pocket costs? First off, there is a Medicare hospital stay Part A deductible. If you were in the hospital from anywhere from 1 to 60 days, the deductible is $1,408 for this year, for 2020. After that, Medicare picks up 100% of the cost. If you happen to be hospitalized for more than 60 days, then on day 61 and thereafter through day 90, you would be responsible for $352 copay or deductible, however you want to look at it, each day, so that someone with only original Medicare coverage, if they were to be hospitalized for a 90-day stay, that could be potentially $11,968 out of their pocket. Now, once we hit day 90 is where those lifetime reserve days come in. So if someone is admitted inpatient to a hospital beyond 90 days continuously, Medicare has what are called lifetime reserve days. That's where Medicare picks up the cost except for $704 of each day of that stay for those additional 60 days. And if these numbers look expensive, they are. Medicare does not have an out-of-pocket maximum or a cap on what the beneficiary could be exposed to pay. Now let's take a look at original Medicare Part B. Most people become eligible at age 65 for Part B, but if they continue working and have group insurance or other benefits, they may delay enrolling into Part B until a later date. Part B does have a monthly premium, which starts at $144.60 per month, but could be higher depending on if you have a higher income. That premium is typically deducted right out of your Social Security benefits. If you're not yet receiving Social Security benefits, then you can set it up to be paid directly to Medicare. Medicare Part B works with any doctor or facility that accepts Medicare nationwide. There's no network, and it's almost 1 million providers now, or just over 1 million, that accept Medicare. So someone with only Medicare Part B coverage would have at the doctor or outpatient facility or other lab services, etc., a once per year Medicare Part B deductible of $198. After that deductible's been paid for the year, Medicare pays 80%. The beneficiary is then responsible for the other 20%. Some doctors can choose not to accept Medicare assignment, and they may charge what's called an excess charge, which is 15% above what Medicare would have paid a doctor that accepts Medicare. And also with Medicare Part B, there is no maximum out-of-pocket or cap. If it would be, for example, a $100,000 outpatient cancer treatment, Medicare Part B would pay 80% of that, but the beneficiary would be responsible for 20% or $20,000 out of a $100,000 treatment in that example. So now that we understand the basics of how Medicare works, the next decision that we have to make is how will we receive our Medicare benefits? There's 2 ways to go about it. Now that we understand how Medicare Part A and Part B work, the next decision that we have to make is how will we receive Medicare? Option 1 would be original Medicare. If you're looking at the chart here on the left, is what you would have with original Medicare. So you would have Part A and B, your hospital and medical insurance. You would have a Medigap policy picking up the difference or most of the difference, and then you'd have a Part D prescription drug plan for your prescriptions. This would be considered the gold standard for most health insurance because in some cases you can have 100% or nearly 100% coverage between all of your medical, out-of-pocket, doctor's office, hospital cost, etc. Or you can choose a Medicare Advantage plan, also known as Medicare Part C. It usually combines Part A and Part B and the drug coverage all in one plan, and they're designed to provide benefits equivalent to original Medicare, the slides we just looked at previously, but they must have a maximum out-of-pocket or a cap each year. Typically that is somewhere between $4,000 and $6,700 per year, depending on the plan. So let's take a look at some important facts about Medicare supplements. First thing to understand is you must have Medicare Part A and Part B to be able to purchase a Medicare supplement. You'll pay a premium monthly for your Medigap policy in addition to your Medicare Part B premium. Medicare supplements cannot include prescription coverage. That is where Medicare Part D would come in. And cost can vary by company and policy and may go up as you get older. Medicare supplements also have a unique enrollment period. When you first turn 65 or enroll in Medicare Part B for the first time, you have 6 months to choose any Medicare supplement without answering any health questions. After those 6 months, insurance companies can ask health questions and can decline your application if they wish because it is a supplementary product. It's not a primary health insurance plan. Medicare supplements also give you a much broader choice of doctors and hospitals since they are accepted at any doctor, hospital, or facility that accepts Medicare nationwide. They follow where Medicare goes. And Medicare supplements are standardized. This means insurance companies can only sell you a standardized policy identified by one of the 10 plan letters, and this means that different insurance companies can charge different premiums for the same exact policy. Here is the chart with the 10 different Medicare supplement policies, and you can see some of these are very robust. Plan F, for example, right in the middle here, covers all of what Medicare does not pay. That plan is not offered for individuals that become eligible for Part A after January 1st of 2020. The good news is that Plan G is identical to Plan F as far as the benefits. The only part that's not paid is the Part B deductible. So if you remember from the previous slide, that's a once per year deductible of $198 for 2020. Plan N, over here on the end, is also another great option. It's very similar to G. It does have up to a $20 copayment for office visits and $50 copayment for emergency room visits, but covers nearly all of the other Medicare expenses 100%. That plan also has a much lower premiums monthly than Plan G. And just to illustrate how these plans do work, this is a copy of a benefit summary right out of a policy from one of our clients. This shows the services covered under Plan G with this particular plan, and you can see over on the left-hand side there's a column of the services, what Medicare pays there in the middle, and what Plan G pays, and then over on the right, which is highlighted, the amount that you would pay if you had Plan G, which is $0 down the line. And again, here this is out of the same policy. This is for the Part B medical services side of it. You can see zeros in all of the fields there except for the Part B deductible. If you can see it, this slide says $185 because it was from 2019. So when comparing Medicare supplements, know that it's easier than it looks. It is an apples to apples comparison, and different companies can charge different premiums for the same exact policy. Let's take a look at an example. Here's the quoting system that we use to help our customers find the best rates. So I'm going to start with my zip code, hometown, Cincinnati, Ohio, 45244. Just as an example, and we'll use a 65-year-old female. We'll look for Plan G, and we'll say non-tobacco, and she'll be starting on. So once I click Get Quote here, this system generates a list of every company that offers Plan G for this particular customer, so we know who has the best rates. We can also see what their rate increase history is, their financial stability, how many years in the market, and a lot of other factors to help us make better recommendations for our customers. Now, if you're comparing Medicare Advantage plans, they're a whole different animal. They have different premiums. Some have no premiums, but each plan is going to have a different doctor network, a different drug formulary. Since the Part D coverage is built in to the Medicare Advantage, they have different copays and out-of-pocket limits, and those plans all can change every year. So if you have a Medicare Advantage plan or are considering one, it's very important to look at your plan each and every year because you don't want to be stuck in a plan that's not going to work for the coming year. Now, up to this point, we haven't talked much about prescription drugs because we haven't gotten to the Part D section yet. One major difference between Medicare and most other health insurance that you might have had in the past is that the drug benefits and the medical and hospital benefits are not connected to each other. Medicare keeps Part D separate completely. So whether it's built into the Medicare Advantage plan or you're purchasing a Part D drug benefit on your own, these plans are completely separated from the medical side of benefits with Medicare. They have their own out-of-pocket cost, their own premiums, copays, deductibles, etc. And that's what we're going to talk about now. So Medicare prescription drug plans may have a monthly premium and an annual deductible, but the deductible is usually waived for Tier 1 and sometimes Tier 2 medications. So if you're just taking generic drugs and you see a plan that has a $400 deductible, it might not mean the deductible applies for your medications. Prescription drug plan benefits work off of a calendar year, January 1st through December 31st cycle. Even if you're signing up for one in the middle of the year, it's going to reset in January each year. And each plan uses a formulary. This is the individual list of drugs covered by that particular plan. And some companies offer multiple plans with multiple different formularies. So really it's important to look at that when comparing options. Part D plans also have different tiers. So as I mentioned before, Tier 1, 2, 3, etc. Each company has different tiers and copays for those tiers. And some cases, the drug might be on a different tier between two different plans. So it might be a Tier 2 medication on one plan and a Tier 3 on another. So again, very important to take a look at that when comparing. Some plans also have what's called prior authorization and quantity limits. Some drugs require you and your prescriber to contact the drug plan before you can fill certain prescriptions. Your prescriber may need to show that the drug is medically necessary for the plan to cover it. Quantity limits just say how much of a medication you can get at a time. So if you've had any drug plans in the past, this is kind of typical. Most companies have a verification process to make sure certain drugs are covered, but you do want to keep an eye out for that with your drug plan. Another term you might hear with Medicare Part D is step therapy. That would mean where a company would require you to try one or more similar low-cost drugs before they would cover a prescribed brand name drug. This takes us to the important enrollment dates. So, since we talked about original Medicare, Part D, and Medicare Advantage, let's talk about that first. You're going to need to get enrolled into original Medicare. The easiest way to do that would be to go online. can also go in person or by calling Social Security at 1-800-772-1213. If you're a railroad retiree, that number is 877-772-5772. Now, if you already are receiving Social Security benefits before you turn 65, actually, you can relax and sit back because your enrollment is automatic. You will get a Medicare card in the mail around 3 to 5 months before your 65th birth month. But for the rest of you, the enrollment period is as follows. You have 3 months to enroll prior to your Part B effective date. Then you have the month of your Part B starting, and then 3 months after that month. So the total enrollment period time here for original Medicare, Part D, and/or Medicare Advantage plans is a total of 7 months. Medicare supplements have a lock-in period of up to 6 months prior, and you have an enrollment period of 6 months after your Part B effective date. If you miss that 6-month date, you may have to answer health questions, which means you could pay higher premiums or be denied coverage altogether. So what's next? Option 1 would be to start calling 30 different places to get rates and information. Or option 2 would be to let us do all the heavy lifting for you for free. If you're leaning towards option 2, then give us a call at 513-466-0209 or click below and go to the website info.medicareeasystreet.com. From here, you'll be able to just answer the simple Medicare questionnaire, let us know a little bit more about you and what your preferences are, which type of plans you'd like more information on. If you're on a cell phone or even using a computer, on this question, you make sure to click the arrow there. Zip code, just so we can look up the plans in your area. And then name, email, phone number. Once you click submit, you'll be able to then either click this big green button to call us and we can schedule the appointment to go over the plan details for your specific area, or you can choose a time here on the calendar and just book an appointment on our calendar there, and a reminder will be sent to your phone and or email. Make sure to check your email or text messages just for a confirmation, and we'll talk to you soon.